Hello, everyone. My name is Ashley, and I'm an associate professor at an academic institution that teaches undergraduate nursing students. Today, I'm going to be sharing with you how I created a virtual hospital utilizing Google Sites as well as its other applications. I had decided to build this hospital due to the pandemic in March of 2020 and knew that I needed to develop something that would mimic the clinical environment. Students were unable to go to take care of patients directly in the acute care settings, and they were very familiar with the electronic health record. So while being familiar with Google Sites, I thought, I'm going to develop a hospital. Let's see how it goes. So the first thing that we're going to make sure that you do is sign up for a Google account if you don't already have one, because you are going to be utilizing Google Docs, Google Excel, as well as Google Sites. So as you can see, I've already signed into mine, but if you haven't, it will say something like sign up or log in, and then you will register for an account. Once you are ready, you will go to this icon that is indicating that there's multiple Google apps inside. And you can, if you already have pre-made documents or things like that, you can always upload things to your Google Drive and then click on them later. I'll show you how to do that. But first we'll go to Google Sites. Once you go to here, on the left-hand side, it will ask you to create a site in New Sites, which is the new recommended version. And then here is the main screen of your document. So just kind of a little navigation. I was trying to move this for you. A little navigation is, this is the main page of your, if you want it to be a clinic or hospital or whatever you want it to be. Let's just first give it a name, Springfield Clinic. That's going to be the site name as well. Usually that will, and then we'll title it there too. So that's the main page. There's these icons over to the right where we can insert either text box, messages, images, embed videos, which I have done before, and embed something from the Google Drive if you uploaded like a document there. There's many different layouts that you can choose from. We're just gonna go and, if you accidentally click on something, again, you never break anything. There's a little delete section here. You can go ahead and delete those. There's also different pages. We will add to that here in a little bit, as well as different color themes if you're not digging the blue or that style as well. So we'll just kind of stick with this for now. You can go ahead and change images that you can upload your own that you find on a website, or you can select images. They have an array of different styles. We'll just pick the galaxy for now. It's going to adjust for readability. Sometimes it makes it brighter or darker, just kind of depending on the colors in the picture. So now what we would like to do is to start adding things. I'm just going to show you an example of something that I created. When I first started, I believe I probably changed my layout about 4 times before I decided, yes, this is the kind of look that I'm going for. So this is an example of my medical center that I created for my students. And I had about 19 students I had to get through for 4 weeks of clinical, so I knew that I needed multiple patient charts. So each student, got one patient. We had 3 faculty facilitating clinical, so each faculty member had 6 to 7 students, so I knew I needed 7 different patients for every single week. That did take me quite a while during the first week as I was doing it by myself, and then I recruited some great nurse educators that helped me along the way. So again, I have my navigation bars to the left. You can have your navigation bars to the top, but we'll kind of go over that. So if you click into week 1, I have my different patient charts. It's complemented by critical thinking questions that go with each scenario, as well as clinician resources, whether it's their drug guide, their nursing diagnosis pocket guide, lab meanings and results, and their medical surgical textbook. I wanted to make sure that this was very clean and concise for them. It's very intuitive. They knew exactly what to do, and it just kind of worked. I helped a colleague kind of build this as well, and she wanted a different approach. She only needed 6 patients. She just did it for a week, and so she kind of utilized this look. She has pictures on her main screen. I have pictures within my charts. I felt it was a little more clean that way. So let's go back to our clinic. So to achieve, that weekly format, I just double click in here and just start typing. We'll just say week 1. I think I had 4 weeks, but we'll just do just 1 for this tutorial. You can change, the font. You can make it bold. You can, center that. And if you want this to be a different color, they have different background screens, kind of different emphasis to make that pop. Or of course you can, upload images or other things like that. See, again, I could just tinker all day. All right, so we want this to actually be there, but to open up on a different page, unless you want to list them all out like one of my colleagues did. Well, I had multiple patients. I didn't want 28 charts just to be on the main page. I just wanted the ones that were relevant for that week. So if you want to do that, you will go over here to the Pages tab. You have the Home tab already. Down below, I'm sorry, it's kind of hidden here. Let me pull it up here. Down below, you have the Add Page down there. So we will go ahead and click that, and we'll just label this just the week 1. Done. So again, now this doesn't have anything in it. And that's okay because we're going to add to it. So I just want to adjust my screen for you so that you're able to see. Okay, so let's go back to the home page. So now to link these, you just highlight the week 1, and when you click this insert link, it will take you to right there. You apply it because it knows it's going to go to that page directly. Now it's hyperlinked, and when we publish this page, you will see what it looks like. So now what we're going to do is let's just go ahead and publish it. So we'll hit publish. I feel as though that almost means like a save button. So we'll publish, and there's the website that you will copy in, and you can paste and give it to whomever you want to access the link. So now that is published, and we can go to preview. And when you go to preview, this is what it's going to look like. Again, as of right now, the navigation bar is on the top. And when you click week 1, that's when it'll open up that hyperlink. Now let's go ahead and add something to that. So there's a button down here that we can X out of preview. Let me show you if you want to change that navigation bar, because I do like mine on the side. There's this settings tab. And if you want the navigation to the top or to the side, now it'll be on the side. Or if you want the color transparent, white, black, or whatever you like, that's that. So now if I go to preview, there my navigation is now on the side. Okay, so now we're in the week 1 page. It's highlighted there. You can kind of see it. So now I want to start adding my patient charts. So we'll say patient 1. And then I just have patient 2. How many patients you have. All right, so in our institution, we're fortunate enough to have a 1-to-6 ratio, sometimes 1-to-7. And so we'll just say that there's 6 patients. Well, now you have to link this to an actual document. So I am part of a Facebook educator group called Teachers Transforming Nursing Education, where very brilliant nurse educators are so willing to share their information that I did gain permission to use a blank EHR document using Google, or a blank EHR Excel document from this educator in Georgia, and it is on that website, on that Facebook website, and she has granted, people permission to utilize this. So I'm going to open up the document, and this is her blank EHR that she had created, and all I did was upload it to Google Excel because I needed this to attach to my site. So you could see here, it's pretty robust. She had different types of tabs here. You can tell a face sheet had like insurance. I'll show you an example of mine, but I got rid of some of these tabs. I just feel like it wasn't pertinent maybe necessarily to what I wanted to accomplish. Maybe later on down the road, I might bring some of these tabs back. I just didn't have enough time to fill out all these tabs. You can tell there's, about at least 12 tabs there. So I did get rid of the face sheet. I kept the summary, the SBAR report, H&P, and the orders. I didn't have any progress notes because I thought my H&P was enough. I didn't have a nurse's note because the H&P I added, I changed this from physical exam to nurse's assessment. So I kind of modified. I didn't have a nursing note. That was my physical assessment. I had a MAR because the students needed to look up medications, vital signs, intake and output. I did have labs. I didn't have a med rec because I had my MAR. But they do have a Braden scale and they have a Morris scale. So it just depends on how robust you want this to be. If I was going to add a tab in the fall semester, any semester, I would add a sepsis score so that they could get used to have practices with that, and perhaps bring the nurse note back. They can write a note about, maybe why the patient was here in their own words, like maybe if they have admitted them. But for this video, so how to link this, once you are all done typing in this information, you are going to go to and click this button, share here. And you can go to the advanced setting and you can change this to either public on the web or anyone with the link, or if your academic institution has, a Google license, maybe it's only the students who have, the .edu account. We'll just say anyone with the link can have it. And then anyone, you want to make sure that anyone can view. So make sure that it doesn't say they can edit or that they can comment, because you don't want any unauthorized person changing your document. So just make sure that it says can view. So just go ahead and just save those settings. And then you will copy this. We'll say done. And then let's go back to our clinic. Again, let's highlight that, and we're going to copy that link and apply it. And now that should link it exactly to that blank EHR. Let's go ahead and I'm going to say, well, I'll just say blank EHR. I was going to change the name, but we just won't do that. So now we're going to go ahead and publish, because again, we're saving. So it's just going to say we're going from this to this. So yes, let's publish that, just saving it. And let's go to preview. Let's go back to home. Again, go to week 1, go to the patient one, and there's our information right there. So how nifty is that? It is their own EHR. So let's go to mine to give you kind of a look of, how I modify and change things. So again, students can either go to clinical week 1 over here or week 1 there. I'll show you this patient number 2. This main screen will open up. This uses the tabs as well. The tabs are now down here. Or the students, I did orientation with them so that they were, aware of how to use this. But just say open up with Google Sheets. Sometimes it'll take, you know, a little while. So you see how in that chart, when you open it up, it has kind of a face on there. I really wanted to give the students some type of realization that this is a patient. Granted, it is for educational purposes, but just have a face to the name instead of it just being, you know, on the computer. So the patient here, I can't show you all the tabs. Maybe if I go down. There we go. So the tab, so this is the summary tab, the S-bar sheet. So I think the most thing that took me the longest is, you know, I'm typing all this out. The H&P has, you know, the meat of the story. This patient suffered from a stroke, and that is what the students were learning about in class. So it was very relevant to what they were learning. It met my course outcomes as well as program outcomes. These were the orders. I had my specific MAR, so with their clinical paperwork, they still had to write down the medications, actions, side effects, teaching, you know, that go along with the meds, intake and output, their lab results. And then I also added a diagnostic tab here. So the diagnostic tab, I found pictures that were that I was able to use on the web, and you know, it shows that this person had a left-sided stroke, so no wonder why they're having right-sided weakness, as well as a cardiology report. They were having AFib, and so the atrial fibrillation kind of linked to that ischemic stroke that that patient was having. And so we just had a real robust conversation regarding this patient when the student was going over their information with me. So I guess that is just a quick introduction to how this can be created. If you want to upload a Word document, like with the critical thinking questions I had it linked to, you would do that with Google Docs. And I'll show you how to do that here. So we're going to open up a new tab, and let me pull up my screen, I'm sorry. Again, with this Google Apps, we will go to Docs and have a blank document open. And then we can just name this, we'll name it Critical Thinking number 1 for the one patient. And then you just put in your critical thinking questions. What is the priority imaging diagnosis? Something like that. So then when you're ready, again, you will share. You will make sure that you are copying the link. You can go to advanced again. You can change it with anyone who has a link. They can view only. You save. Just copy that again just to be sure. And then when you go back to your clinic, copy that, link it into it, apply, publish to save it. And then when you preview, you have your patient information. And then you have your critical thinking questions. So super fun. Students had, I got a lot of positive feedback from students regarding this learning. And there were some students that really wanted that face-to-face, which I would have wanted to, but unfortunately we were unable to do that. So I hope that this video helps. If you have any further questions, please reach out to me and I would love to answer any questions you have. This is real intuitive. Once you do it a couple times, you'll get to it. Again, my email address is ashley.kennedy@bryanhealthcollege.edu. Bryan is B-R-Y-A-N. I hope you have a good rest of your day and have fun with this. Thank you.